So my name is Jim Cowan, and I'm here today as I guess someone who pays into the public purse. I'm also someone who's interested in data. I'm a doctor. I'm interested in the problem that you have, and I worked in health insurance for 20 years, so I've got some background in this area. And I want to make a suggestion that I think may help you on the side of, basically the side of acquiring more money to solve this problem of access, which I think you've correctly identified as being due to reimbursement rates being low and decreased in Medicaid in this state. And the point I want to speak to is the role of managed care in the reimbursement process that you're involved in, because there's good evidence from across the nation that managed care of government programs doesn't always save money, and on occasion it's not only cost neutral, it actually is more expensive to the taxpayer than fee-for-service medicine. About 65%, I believe, of Medicaid recipients in Rhode Island receive their care through a managed care program. And 2012, Robert Wood Johnson Foundation made the comment that traditional state-run fee-for-service programs are more efficient than managed care programs in most cases. We have a situation here in Rhode Island where the Office of the Attorney General, of the Auditor General, has over several years made comments along the lines of saying that the complexity and growing complexity of Medicaid managed care programs adds to the challenge of accurately accounting for all Medicaid program-related financial activity within the state's financial statements. EOHSS lacks strong oversight procedures regarding fiscal monitoring and contract settlement, and nearly 63% of Medicaid benefit expenditures pass through this system, which is poorly monitored. They need to develop a comprehensive risk assessment and monitoring plan to ensure that managed care expenditures are validated and settled for each contract period. More stringent audit and financial monitoring procedures should be employed, etc. And this has been the gist of their report from the OAG for several years now. There's also a bill which has been held for study in the past, which would request conduct or oversight study or audit of the privatization of Rhode Island Medicaid programs. When this was done in Connecticut, there was overpayment of about $50 million a year found in 2012, a figure that would be proportionate in Rhode Island, but we should consider larger because of inflation since then. And this would be significant savings if we were able to recover that would be able to pay for the services that you're unable to deliver right now, because this money is not going to providers, it's going into basically the failures of contract management of the contracts that you have with managed care providers. So I would urge the committee in its recommendations to request such an audit be done, and that the committee would support bills that will be introduced. I don't have their numbers yet because they don't have numbers, but they will be introduced to request this audit in 2020. Thank you. Questions?